presentation. They were doing atrial arrhythmias, and they did a very good job at the beginning of explaining to the class about atrial arrhythmias and so on. I think they did a good job at that. So, just briefly, I'm going to highlight a couple of things that I think will help us more to appreciate the antiarrhythmic drugs. So this is what everybody understands what the term normal sinus rhythm is, okay?
Yes.
Everybody understands what that means?
Yes.
Okay, so it's just showing you a normal ECG. So normal sinus rhythm implies normal sequence of conduction originating in the SA node and proceeding to the ventricles through the AV node balance in the system. Okay, that's normal. And once the electrical impulse is generated in that way and transmitted in that way, then your ECG should look this way. So your EKG or ECG characteristics from a normal sinus rhythm is that you should have regular, narrow, complex, similar to what you see here. Rate should be about 60 to 100, or in that range. And of course, each Gauss complex must have a period before it. Alright, that's just looking at a normal ECG trace. Okay, now another term that you guys heard a lot during the presentation was refractory period, right? Effective refractory period. And it's important that in talking about arrhythmias, we understand what is this term talking about. Anybody understand what refractory period means? You guys are using the term a lot.
Is the period during which no action potential can occur?
Good. So, in other words, once the SA node fires, right? And once an action potential, let us just consider one cell. Let us consider one ventricular cell at this point. Once that ventricular cell has been depolarized, another action potential cannot begin in that ventricle. That's a refractory period. Once an action potential has been initiated, for the lifetime of that action potential, another action potential should not start. And we say that is a refractory period of that particular cell. Okay? Or the effective refractory period. So look at this definition. In fact, looking at it in that way, what it means is that the refractory period can be considered as the duration of an action potential. Yeah? Because while that action potential is ensuing, another one should not start. So, after an action potential initiates, the cardiac cell is unable to initiate another action potential for some duration of time. And usually that's for the time of the action potential duration, and that is what we mean by refractory period. Okay? So this is the effective refractory period here, because during this time, another action potential cannot be initiated. Another thing that was mentioned over and over again, of course, was given, and I think everyone understands at least that we're not really trying to get down to the nitty-gritty of, okay, the dynamics of what each of these things will be, but we want to have an appreciation of what the different mechanisms are. We want to appreciate what is going on and what they affect. These different mechanisms that give rise to arrhythmias. Okay? And I think we heard these over and over again, that there are four main causes of arrhythmias, that there's re-entry, there's after depolarization, okay, and that there's ectopic pacemaker activity, and there's heart. Everybody understand what these things mean? For example, everybody understands what we see when we say there's heart block, right?
Yeah.
You know that there is impairment of conduction through the
AV node.
Now everybody understands what ectopic pacemaker activity is, okay? This is where any piece of the heart tissue other than the SA node, which is the heart's pacemaker, acts like the SA node and generates impulses. Right? So it's like you have a false SA node in other tissues of the heart. They are spontaneously depolarizing. That's what ectopic pacemaker activity is. Okay. Now I want to talk about the phenomenon of delayed active depolarization. I'm putting it simply, and I want you to appreciate it simply. Now, non-pacemaker cells, remember that the electrical activity of the heart is generated in where? Originates in pacemaker cells. So how do non-pacemaker cells become depolarized? The impulses are transmitted along the conduction pathway and it gets to them, but they themselves are not pacemaker cells. Ventricular cells are not pacemaker cells. The impulses originate in the SA node primarily, yes?
Yeah.
So, in order for your ventricular cells to become depolarized, they are going to become depolarized by the impulses that came from the SA node. So, typically the normal situation that should happen is that a non-pacemaker cell requires action potential that is coming from the SA node for it to be depolarized. Non-pacemaker cell, for example, being a ventricular cell, muscle cell. Now, in delayed after depolarization, they don't require that to happen. What we're saying is that for some reason, these non-pacemaker cells manage to depolarize themselves without that impulse coming in from the SA node. And the question is, how does something like that happen? A good scenario to use to explain delayed depolarization, okay, and then you can actually have early or delayed after depolarization, but it's the same thing, it's just early or late tells you when it happens. Now you can have a situation where a non-pacemaker cell depolarizes itself. For example, in the event that you have, it can be drug induced, like or cardiac glycoside like digoxin. Remember how digoxin works? Now let us say someone, for example, has digoxin toxicity. Do you recall how digoxin works? That digoxin works by doing what? Increasing calcium concentration in your cardiac muscle cells. So in scenarios, in fact, in any scenario in which the calcium concentration in the cell increases, that can trigger delayed after depolarization. Because what we're saying is that because, for example, the digoxin is causing this calcium to build up in the cell, it influences the excitability of the cell to such a point where the cell can actually depolarize itself, and that is what delayed after depolarization is. So, for example, let's say you give a person digoxin and you give them too much digoxin, then you end up with excess calcium within the cardiac muscle cell. Now, do you remember that calcium in the cell is driven by a calcium-sodium exchanger? Remember that? So that the excess calcium that builds up in the cell exits through the sodium-calcium exchanger, and what happens is that the build-up and the change in the ionic currents excites the cell. Okay? So it is abnormality in the calcium and sodium levels that leads to the excitation of the cell. Because you will recall that, for example, for the action potential of your ventricular cells, this is the one that looks like this, right?
Mm-hmm.
Yeah? It's not for the pacemaker cell. You recall that phase 0 is due to what? Sodium. So the change in calcium, for example, that happens with the digoxin drives the sodium-calcium exchange, and the increased entry of sodium as a consequence of that through the sodium-calcium exchanger causes depolarization of the cell by itself. This is called delayed after depolarization, or it can be early after depolarization. I'm going to show you the differences. So that is what an after depolarization is. Typically, the impulses that are coming from the SA node will spread along the electrical conduction circuit of the heart until they get to non-pacemaker cells like the ventricular cells, and it is that triggers the contraction of those ventricular cells. The term after depolarization refers to the fact where these cells can actually depolarize themselves. And that can happen in instances. Primarily, the main mechanism that explains after depolarization is calcium overload. Anything that triggers calcium overload in the cardiac myocytes can cause delayed after depolarization. The reason it is called delayed versus early after depolarization depends on where the after depolarization is triggered. So, typically for delayed after depolarization, it happens during phase 4. What this means is that this excessive calcium triggers the extra action potential in phase 4, early in phase 4. Now, what is happening here? Why is this called early after depolarization? Here, in this phase. What phase is this happening?
Phase 2.
It's happening in phase 2.
Mm-hmm.
Now, what ion is usually responsible for phase 2?
Calcium.
So, depending on where in the action potential after depolarization occurs, we say it is early, or delayed. In delayed, it's called delayed because action potential has finished and it's now in the phase 4 where another one would have started, but it actually begins before phase 4 is finished. So it's called a delay. But it's called an early active depolarization because what we're saying, this is someone that was on the digoxin therapy. Typically what is happening in phase 2, remember that's a pattern phase where calcium is beginning to do what? This is calcium. What causes a plateau? Good. But what we're saying is the calcium overload spikes, and what is supposed to happen with this? Potassium is supposed to start to leave to cause phase 0. But the active depolarization is because of the excess calcium spikes the actin potential here. And what this means is that phase 3 is delayed. Alright?
So does that mean that sodium came in there? A little bit of sodium or something?
Yeah, it means that the calcium entry here was spiked. Okay? And here what it means is that it's the same thing. The actin potential. Normally what would happen, remember this is the end of phase 3, coming down to phase 4. And phase 4 will have it stand before a new actin potential begins. But because of the abnormality of calcium, it triggers an active depolarization. Okay? So it's the same mechanism of action, but depending on when in the actin potential, which phase it happens. It's called delayed, whether it happens in phase 4 or early it happens further. But the mechanism that triggers delayed active depolarization is anything that increases calcium. So you see it's calcium. And so what this means, the importance of us going through is we're understanding that this will affect the heart's electrical conduction system. It's going to change how your ECG will look because of this abnormality. And because of that, it can cause an arrhythmia. Because an arrhythmia is any abnormality from normal rate and rhythm. So active depolarization is a mechanism by which you can have an abnormal rhythm of the heart. Okay, this is one mechanism. Ectopic pacemaker activity, as I said before, is when there is an ectopic focus. This is an area of tissue anywhere other than the node, especially the SA node, that is suddenly beginning to fire as the SA node is generating electrical impulse. So an ectopic pacemaker, or it's sometimes called an ectopic focus, is an excited group of cells that causes a premature heartbeat outside the normal functioning SA node of the heart. So that can be, as you saw from the presentations, you can have ectopic foci in the ventricles or in the atrium. And those trigger off and send out impulses. So the question is, what causes ectopic foci? Well, ectopic foci can develop in your heart, for example, in response to heart disease. So in certain pathological conditions, like when a person has had ischemia, which is damage to the heart, what happens is that the damage, for example, that even happens in the myocardial infarction. The damaged cells, some of them are going to die as a result of the heart attack, and when they die, they are dying by apoptosis. Their membranes become very leaky, and all of the ions that are leaking out of the cells, because remember they're damaged, there's no proper control of their function. They become leaky, and the leaking out of the ions causes weird currents in the cells. Okay, so that's a mechanism. That's why any other piece of tissue can cause its own generation of electrical impulse, like an ectopic, and that can happen anywhere. Especially, for example, in ischemia, which is damaged tissue, the leaking of the ions can generate, as I said,